Hey guys, John here with NRSNG.com. Thank you so much for visiting. Today we're going to talk about seizures. Before we get started, I wanted to remind you guys to head over to rncrush.com where you can find our new mobile app that allows you to, it has 4 different game modes, so it's actually an NCLEX prep game that's available on your mobile phone, tablet, whatever, where you can actually play games as you study for the NCLEX. Okay, so let's get right into it. Today we're going to talk about seizures. There are 3 basic categories for seizures. First we have focal, then we have generalized, and then we have unclassified. Okay, so let's break those down. Within each of those classes there's a couple different kinds as well. So under a focal seizure, what that basically means, if you think focal, it means local. It means in one location. So you have our focal seizure, which is basically localized. It means one area of the brain is where this is actually occurring. Okay, so a seizure, just to be clear, is actually an abrupt, abnormal, excessive, uncontrolled discharge of neurons in the brain. Okay, so we know we have our axon. At the bottom of our axon we have where the neuron actually lets out these neurotransmitters, and then we have our receiving end, of course. So what's happening during a seizure is we're having this overexcitement of these neurons. So it's just letting out all these different neurotransmitters. We have dopamine, serotonin, norepinephrine, epinephrine. So there's all different kinds of neurotransmitters, and those are what the overexcitement, that's where that's happening. It's just letting out all this extra neurotransmitter, and so it's causing this seizure in the brain. Okay, so that's really the definition of seizure. It's this uncontrolled, way too much, abrupt, just sudden excitement of these neurons. Okay, so again, with focal, it's localized. It's one specific area in the brain on one hemisphere, in one location, we're having this excitement. Okay, and there's 2 different kinds of focal seizures. You have simple and you have complex. With a simple seizure, the patient will remain conscious, whereas with a complex seizure, they may lose consciousness during that. But it's still within a very specific location within the brain. Okay? Where when we then move over to generalized seizures, so you think focal, you think one space. When you think generalized, you're thinking the entire area. So we're talking both hemispheres of the brain, and we're talking it's occurring throughout the brain. Okay? And there's 6 different types of generalized seizures. You have absence seizures, and the old name for that was petit mal. Okay, but the name you need to learn is going to be absence seizure. Then you have myoclonic, clonic, tonic, tonic-clonic. Old name for that was grand mal. And then you have atonic seizures. The kind that you're going to be tested on and see most often generally is going to be absence and tonic-clonic seizures. That's generally probably what you're going to see the most. So with absence seizures, the patient is going to lose consciousness, but for less than 30 seconds. And there's going to be slight twitching with that as well. With the tonic-clonic seizures, initially they're going to have a contraction. So they're going to tighten up real quick, and then they're going to go into twitching. Okay, so that's what they may see. It can last seconds to minutes. So that's a lot of times the patients that are going to be admitted to the hospital, to your neuro floor, or to your neuro ICU, or possibly your ICU. So what'll happen is they'll have this tight contraction, and then they'll start twitching. And they may lose consciousness. They may lose, when they wake up, they may have this aura, or when they wake up, they may have this feeling that they don't remember what happened. They don't remember how long it happened. And then before patients have seizures, sometimes they'll have this aura where they can sense that it's coming. Okay? And then we have unclassified seizures. So another thing that you need to be aware of, and this probably won't be tested necessarily on like the NCLEX or anything, but something that you'll actually see in the hospital are what's called status epilepticus. And with that, there's no recovery between episodes. So the patient's just having these seizures with no real recovery. So what we can do with this is we can sedate the patient, and we can stop the seizing, the visible signs of seizing, but they may still be having that excessive excitement of the neurons within the brain. Okay, so what's some things we're going to do for our patients? Well, the things that you're going to need to keep in mind with seizures, and the thing that you're definitely going to be tested on is that we don't want to, the first thing we're going to do is we're going to protect the patient. We're going to keep the patient safe, but we're never going to want to stick anything in the mouth. There used to be this thing with putting bite blocks in there when they were having seizures. That's now kind of frowned upon. So you're not going to want to do that. You're not going to want to restrain the patient. All you're really doing during the seizure is just keeping the patient safe, okay? That's your primary goal, okay, is keep the patient safe. Be prepared to suction the patient and turn the patient on the side to prevent aspiration. As they lose consciousness, they may lose the ability to maintain their secretions, and they may aspirate. So you're going to want to prevent that. So that's really your whole goal if you notice one, if you see one. Now in the hospital, so if you have a patient, and then so we need to talk about seizure precautions. So what are seizure precautions and what does that mean? There's a couple things that we're going to do with seizure precautions. We're going to do bed low. Okay, we're going to pad side rails. Okay, and then we're also going to just try to determine the cause. If we know the cause, we can actually treat the cause. So a couple reasons for seizures. The one thing that we see oftentimes with our patients is either hyper or hyponatremia. You get your sodium below 120, you get your sodium above 160, there's a good chance that the patient may have seizures. That's a real common cause for seizures. Drugs is another reason a patient may have seizures. Some medications can actually have seizures as a side effect. Another thing can be nutrition. Some of the vitamins, deficiency in some of the vitamin B's can actually lead to seizures. The thing I see most often is going to be the sodium. Okay. Biggest thing you need to know for NCLEX is keeping the patient safe, bed low, loose and restrictive clothing, just ABCs, protect the airway, protect their breathing, and make sure that they're able to perfuse appropriately. Okay. Let's talk a little bit about what we would do in an ICU or in an emergency room if a patient were to have a seizure. There's a couple medications called AEDs, anti-epileptic drugs. And so if a patient comes into the ED with a seizure, the first thing that we're going to do is we're going to give them Ativan. Okay? Generally we'll give them a fast dose of Ativan because it works very quickly and it can last quite a long time. After we can control the seizure, then we're going to put them on like phosphonatoin or Keppra. The reason we do that is because those can last about 12 hours, and so we'll give them Q8 or Q12 hour doses of Ativan, or I'm sorry, Keppra or like phosphonatoin or phenytoin. And we're going to want to check their blood levels. So that's another thing to keep in mind. We're going to want to check blood levels of Dilantin to see that our patient's actually in a therapeutic range. There's actually therapeutic ranges with those drugs, so we're going to make sure that our patient has the appropriate amount of that drug in their body. If we can keep it at that level, then there's a good chance we can prevent future seizures. So what we'll generally do is we'll start with, so once we've stopped the seizure with the Ativan, we'll give them a loading dose of Dilantin, and then we'll follow up with these medications. What we'll do is we'll add one medication, and hopefully we can control the seizures with that one medication. If we can't, then what we'll do is we'll add others. A lot of times the medication we'll use is phosphonatoin. I'm sorry. Phosphonatoin. And phosphonatoin, it's actually a derivative of phenytoin. And so what phosphonatoin does is phenytoin actually can cause cardiac arrhythmias, and it can cause necrosis at the site. So phosphonatoin is a little bit less damaging. It has a little bit less potential to cause those severe side effects. So we'll give phosphonatoin. You still need to be careful. You need to give it slowly because it can cause tissue necrosis. It can cause, so the thing we're looking for are arrhythmias, necrosis, and decreased BP. So we want to give this through as big a line as possible, hopefully a central line, and we're going to want to give it slowly. We want to watch blood pressure, give it slowly so that we don't bottom our patient out. If you have a patient who already has decreased blood pressure, you'll want to be careful as you give this medication. It can also cause necrosis at the site, and it can cause arrhythmias. Okay, so if this medication isn't effective in controlling the seizure, then we can also add Keppra. These are just some of the common medications. I'm not going to tell you all of them. We can add Vimpat, Keppra, we have fosphenytoin, and then things that we would use in possible, like if they began to have a seizure again, we have Versed, and then we also have like Ativan. And those are things that can stop a seizure right away. Those are going to be the biggest ones. And then there's also Valium, of course, that we can use to stop the seizure. Okay, those would kind of stop it, and these will kind of prevent. Okay, so like our benzos are going to stop, and these AEDs are going to prevent seizure. Okay, so those are some of the things you want to keep in mind. Let's talk about some of the ways we diagnose seizure. First of all, we would possibly see it, but then what a neurologist may do is they may order an EEG, and what that does is that actually looks at the brain waves. You put a bunch of little electrodes all over the head, and what it allows them to do is allows them to diagnose that yes, the patient's actually having a seizure and where at. So it detects kind of where at, and detects any abnormalities in the brain waves. There's multiple different kinds of brain waves. We won't get into it much here, but we have gamma, beta, alpha, theta, delta, just all kind of those Greek letters. So gamma, beta, alpha, theta, delta, sorry. Those are the different brain waves. What a neurologist can do is they can actually look at those and look at a complete EEG and determine where the seizure is, how severe it is, and if the patient's improving. Another thing they may do is order MRI. That can kind of help them notice cerebral atrophy and different activities within the brain. Okay, so those are really some of the basics of seizures, what they are. The things that I would focus on if I were studying for NCLEX, I would focus on absent seizures, I would focus on tonic-clonic, and I'd focus on just basics of focal. I would then also focus, of course, on what an EEG is, what's the basics of it, and some of the medications we give, fosphenytoin. I think they're going to mostly test you probably on Dilantin, even though what we use pretty much more commonly is going to be fosphenytoin. And then I would also focus on the fact that you're not going to put anything in the patient's mouth. You're just going to keep them safe, keep the bed low, etc. So those are the things I would focus on if I were preparing for NCLEX about seizures. All right, you guys, thank you so much. If you have any questions, you can email me, contact@nrsng.com. I'm always excited to hear from you, and if you enjoy this video, you can click up and subscribe, whichever side the subscribe button's on, or down below. And then you can also check out our books, our apps, and our blog. All those links are down below. So thank you very much, and if you enjoy this video, be sure to share. Thank you.